So now we are on the last chapter of the textbook, looking at chapter 14, Methods of Therapy. So although we're not together where we can have a full discussion about this particular icebreaker, I decided to leave it in because I wanted you to take a moment to reflect. What is therapy like? It says to ask you all to reflect on following questions that hopefully will allow you to start thinking about what those concepts might be in terms of when we're talking about psychotherapy. So the first question would be, many students are interested in psychology as they want to practice therapy. Think about your stance in that particular statement. The second, what do you think psychotherapy sessions entail? What is it like? Third, but not least, what theoretical psychological approach do you think you would result in the most effective treatment, and why do you think that? We've talked about so many different areas in psychology. This is just to give you a tip of the iceberg, so to speak, of figuring out how we would help individuals by the use of psychotherapy. So the objective for this chapter is simply this. We're going to identify some of the major types of mental health professionals that's involved with psychology, provide you with a proper definition, an operational definition of psychotherapy. Then we're going to identify those major areas within psychotherapy and look at the developers of these particular therapies and help you learn how to describe the different techniques that's utilized in these different forms of psychotherapy. Also, we're going to look in and identify the different forms of therapy that involves more than the individual client. You'll learn how to evaluate the evidence that's going to regard the effectiveness of psychotherapy, identify as well as be able to describe the cultural factors that would influence the practice of psychotherapy, apply steps that might help you to be able to obtain help within a psychological problem or issue, help you to identify the most major classes of psychiatric drugs as well as specific drugs within each class. We'll talk about some of the advantages as well as disadvantages of those psychotropic drugs, learn how to describe other forms of biomedical therapies, and be able to explain why they're so controversial. Then we'll try to describe as well the functions of modern community mental health center and how it can revolve in helping improve the daily functioning of a person. And then last but not least, talk about and discuss the evaluation on whether or not policy of deinstitutionalization can actually be successful. So let's start with the types of psychotherapy. All right, so right now I want to talk about the different types of mental health professionals that's involved. Understand in psychology you're going to find different hats that's going to be covering different areas within the field that will hopefully give you a glimpse and understanding just how expansive psychology is. As for myself, I'm a clinical psychologist by trade. That was what my training had been in. And more or less, I have a doctoral degree in psychology, what we call PsyD. But you also have clinical psychologists who've earned a PhD. And actually here at Jackson State University, we do have a clinical psychology program here where a person can earn their PhD in the field. So, of course, in order to get a doctorate, you have to go to an accredited college or university, as well as if you want to practice in the community, out in the field, then you would want to pass a licensing examination, and that's generally given through the Board of Psychology. Within every state, they have this particular facet. Now, clinical psychologists, we kind of specialize in being able to assess, meaning we administer psychological tests. We learn and teach and show how to diagnose different mental disorders, as well as provide therapy through psychotherapy, and that's through the different theoretical orientations that I'll talk about a little later. Now, counseling psychologists, they too have a doctoral degree in psychology. They also need to pass a licensing examination. However, their goal is more on the clinical of counseling people with psychological problems rather than assessing or giving tests. They're going to do more of the counseling component. And they'll look at the problems falling within a milder range of severity than we as clinical psychologists might. Psychopathology is something that we revolve around, and we want to hunt and break down into the raw basics to trying to have that understanding. But counselors, they want to help people learn how to cope with their issues, more so than do any kind of testing. All right, so with that being said, now let me point out psychiatrists. Psychiatrists, the biggest difference between a psychologist and a psychiatrist is that a psychiatrist, they have their medical degrees. They're an MD first, okay? And then what they've done is they've completed a residency in psychiatry where they do some extra learning in the field so that they have the psychological components attached. Now, there's also social workers who are either clinical or psychiatric, and they earn a master's degree in social work. Their knowledge base is community oriented, as well as working within different organizations. Like an inpatient hospital, you may find a social worker there as well. And they look toward being an advocate to help individuals receive the services that they need that's going to help them to cope better, whatever their situation is. Now, psychoanalysts can be either a psychiatrist or psychologist who completed additional training in psychoanalysis. And Sigmund Freud is the father of psychoanalysis, just to give you a heads up on that. So that training involves learning a lot about different aspects of the personality, those psychosexual stages, being able to understand the triad, which is the id, the ego, the superego, learning how to take all of this in. Now, my training personally has been within psychodynamics, which is an extension of. It's more what Neo-Freudians have moved toward, because although we see things a lot similar to what Freud seen it, we also know that there's certain differences. So I can talk for hours on that alone, but just to give you the idea, that's a little bit of what psychoanalytic process would be about. Now, there are counselors who can be licensed professional counselors, or what we break down to call LPCs. Generally speaking, they've earned master degrees, and they can work in private practice, public schools. They might be in college counseling centers, as well as health clinics. Then you have psychiatric nurses, and they're RNs who've also completed a master's program within psychiatric nursing specifically. All right, so now it's time to see if anything that I've shared with you has kind of clicked for you so far. Dr. Garcia has a medical degree and recently completed a specialized residency program. In her practice, she diagnoses and she treats psychological disorders, and she often prescribes biomedical treatment such as medication. So, what type of mental health profession is Dr. Garcia in? Would she be a clinical psychologist, a psychiatric nurse, a psychiatrist, or a psychiatric social worker? Answer would be psychiatrist. Main key feature in that answer would be the fact that Dr. Garcia holds a medical degree and completed a residency within psychiatry. Remember, with psychiatric nurses, they have their medical degree that's not a specialization training program involved. And while clinical psychologists, we've earned doctoral degrees, but it's not a medical degree. And a lot of people, let me break a myth because it's no longer the case. Many years ago, maybe 20, 25 years ago, it was, but not anymore. When we're talking about psychopharmacology, once upon a time, psychologists could not prescribe medication. That's no longer the case. If you go through the proper training channels, you too, as a psychologist, will be able to not only provide psychotherapy, but you may be able to provide medication as well if you had the proper training. And it also depends on what state you're working from. Okay, so let's move on from there. All right, so now let's look at the different types of psychotherapy. Understand, psychotherapy is a form of talk therapy in which it's coming from the facet of looking at different frameworks that's within psychology and how we might utilize these different modalities for treatment sessions, and that's usually done with a clinician or therapist. It's used widely in terms of psychotherapy, looking at the different models specifically toward abnormal behavior. I've mentioned previously about psychodynamics, which generates from Sigmund Freud. Then you have behavioral, you'll have humanistic, you'll have cognitive, and we'll talk a little bit more about those individually in a little while. So psychoanalysis is a method of therapy in which the patient talks about his or her experiences, early childhood, and dreams. First, understand that it refers to both a theory and a type of therapy based on the belief that all people possess unconscious thoughts, feelings, desires, and memories. According to the American Psychoanalytic Association, psychoanalysis can help people understand themselves by exploring their unrecognized impulses hidden in the unconscious. It's in psychotherapy that people can feel safe as they explore their feelings, desires, memories, and the stressors that can lead to psychological issues. Research has demonstrated that the self-examination utilized in the psychoanalytic process can contribute to long-term emotional growth. So as we delve into psychoanalytic theories, we know that psychoanalysis is based on Freud's theory that people can experience catharsis and gain insight into their state of mind by bringing the content of the unconscious into conscious awareness. It's through this process that a person can find relief from psychological distress. The psychoanalytic theory also suggests that a person's behavior is influenced by their unconscious drives. Emotional and psychological problems such as depression and anxiety are often rooted in conflicts between the conscious and unconscious mind. Personality development is heavily influenced by early childhood events. Freud suggested that personality is largely set in stone by the age of 5. People use defense mechanisms to protect themselves from information contained in the unconscious. Skilled analysts can help people bring certain aspects of their unconscious mind into their conscious awareness by using psychoanalytic strategies such as dream analysis and free association. Free association is a basic process in psychoanalysis and other forms of psychodynamic psychotherapy in which the patient is encouraged to verbalize without censorship or selection whatever thoughts come to mind, no matter how embarrassing, illogical, or irrelevant. The object is to allow unconscious material, such as inhibited thoughts and emotions, traumatic experiences, or threatening impulses, to come to the surface where they can be interpreted. Free association is also posited to help the patient discharge some of the feelings that have given this material excessive control over them. Interpretation in psychodynamic therapy provides an explanation by the therapist in terms that are meaningful to the client of the client's issues, behaviors, or feelings. We use interpretation typically along the lines of the particular therapy's conceptual framework or dynamic model. In psychoanalysis, for example, the analyst uses the constructs of psychoanalytic theory to interpret the patient's early experiences, dreams, character defenses, and resistance. Although interpretation exists to some extent in almost any form of therapy, it is a critical procedural step in psychoanalysis and in other forms of psychodynamic psychotherapy. It is a key technique in which the therapist attempts to help the client gain insight into their unconscious thoughts, feelings, and motivations by connecting conscious behaviors to underlying unconscious patterns. This is often done by identifying recurring themes or connections between past experiences and current behavior, increasing self-awareness and facilitating change within the client's psyche. According to the American Psychoanalytic Association, psychoanalytic treatment is based on the idea that people are frequently motivated by unrecognized wishes and desires that originate in one's unconscious. With that being said, it can be identified through the relationship between the patient and the analyst. By listening to patients' stories, fantasies, and dreams, and discerning how patients interact with others, psychoanalysts offer a unique perspective that friends and relatives might be unable to see. The analyst also listens for the ways in which these patterns occur between patient and analyst. What is out of the patient's awareness is called transference, and what is out of the analyst's awareness is called countertransference. Talking with a trained psychoanalyst helps identify underlying patterns and behaviors. By analyzing the transference and countertransference, the analyst and patient can discover paths toward the emotional freedom necessary to make substantive, lasting changes and heal from past traumas. Typically, psychoanalysis involves the patient coming several times a week and communicating as openly and freely as possible. While more frequent sessions deepen and intensify the treatment, the frequency of sessions is worked out between the patient and analyst. In contrast, psychodynamic therapy takes a brief approach. There is more interaction between the therapist and the client, similar to having a conversation. The therapist focuses more on daily life issues rather than sexual undertones and the remote past. Although there is relevance, the clinician works more in the here and now. Now, we will take a look at humanistic psychology. This approach to psychology took shape between the 1940s and the early 1970s and is widely seen today as a family of widely used approaches to psychotherapy and counseling. It derives largely from ideas associated with existentialism and phenomenology. It focuses on individuals' capacity to make their own choices, create their own style of life, and actualize themselves in their own way. Its holistic approach emphasizes the development of human potential through experiential means, rather than the analysis of the unconscious or behavior modification. Some of the principal players associated with this approach include Abraham Maslow with his theory on the hierarchy of needs, Carl Rogers' person-centered theory, and Rollo May's influence on both existential and humanistic theory. Rogers developed client-centered therapy, later renamed person-centered, a non-directive therapy that allowed clients to deal with what they considered important at their own pace. This method involves removing obstacles so the client can move forward, freeing him or her for normal growth and development. By using non-directive techniques, Rogers assisted people in taking responsibility for themselves. He believed that the experience of being understood and valued gives us the freedom to grow, while pathology generally arises from attempting to earn others' positive regard rather than following an inner compass. Rogers recorded his therapeutic sessions, analyzed their transcripts, and examined factors related to the therapy outcome. He was the first person to record and publish complete cases of psychotherapy. Gestalt psychology is a psychological approach that focuses on the spirited organization of one's experience that formulates into patterns or configurations. Gestalt is German for totality, or in essence, whole. This view was substantiated by German psychologists Wolfgang Köhler, Kurt Koffka, and Max Wertheimer in the early 20th century as a revolt against structuralism, which analyzed experience into static, atomistic sensations, and also against the equally atomistic approach of behaviorism, which attempted to dissect complex behavior into elementary conditioned reflexes. Gestalt psychology holds instead that experience is an organized whole of which the pieces are integral. A crucial demonstration, 1912, was that of Wertheimer with two successively flashed lights, which gave the illusion of motion between them rather than of individually flashing lights. Later experiments gave rise to principles of perceptual organization, which were then applied to the study of learning, insight, memory, social psychology. One of the more widely recognized therapies is behavior therapy. This form of psychotherapy applies the principles of learning, operant conditioning, and classical conditioning to eliminate symptoms and modify ineffective or maladaptive behavior patterns. This therapy focuses on the behavior itself and the contingencies and environmental factors that reinforce it rather than exploring the underlying psychological causes of the behavior. Various techniques are used in behavior therapy, such as behavior rehearsal, biofeedback, modeling, and systematic desensitization. When using systematic desensitization, we know it is a form of behavior therapy in which counter-conditioning is used to reduce anxiety associated with a particular stimulus. That would involve several stages, such as having the client trained in deep muscle relaxation, then implementing various anxiety-provoking situations related to a certain problem, such as fear of death or a specific phobia, which are listed in the order from weakest to strongest, and seeing each of these situations being presented in imagination or reality, beginning with the weakest while the client practices muscle relaxation. Since muscle relaxation is incompatible with anxiety, the client gradually responds less to anxiety-provoking situations. See also covert desensitization, in vivo desensitization, and reciprocal inhibition. Gradual exposure therapy is a psychological treatment that involves gradually confronting fear in a safe setting with a trained therapist. The goal is to change your response to the thing or situation you fear and to help you learn to manage your anxiety. Therapists typically start with mild to moderate exposure and gradually increase the intensity. For example, if you're afraid of heights, you might start by looking at pictures, then look out of a window, and eventually go higher. Exposure therapy can help treat many mental health conditions, including phobias, panic disorders, obsessive compulsive disorder, post-traumatic stress disorder, and generalized anxiety disorder. Therapists may use a variety of approaches, including imaginal exposure, where you focus on imagining the thing that causes you anxiety. We've discussed the theory of behavior therapy, and now let's look into some of the techniques therapists use. First, let's discuss modeling. There are several types of modeling, but for behavioral therapies, it is defined as a technique used in cognitive behavior therapy and behavior therapy in which learning comes from observation and imitation alone without comment or reinforcement by the therapist. Behavioral modeling is a training technique used when workers are instructed on and then shown a skill or problem-solving method that they practice using role play or a computer simulation. Then you have virtual reality therapy. It is a form of in vivo exposure therapy in which clients are active in a three-dimensional computer-generated interactive environment, allowing them a sense of actual involvement in scenarios related to their presenting problems. This treatment is currently used primarily for anxiety-related disorders, such as fear of flying. To give you an example, one tool I used was the game The Sims. It allowed the client to create scenarios that were anxiety-provoking and then make changes to alleviate the anxiety. Once the client played the scenario out in the game, they were asked to recreate it in reality and use the same techniques they utilized in the game. Using virtual reality therapy boosts confidence and eases fears. Yet another effective intervention technique is aversive or aversion conditioning, the process by which a noxious or unpleasant stimulus is paired with an undesired behavior. This technique may be used therapeutically, for example, in the treatment of substance abuse, in which case it is called aversion therapy. An example of this is sensory aversion therapy. This type of therapy relies on creating very uncomfortable sensations, such as a disgusting taste or smell, as a form of aversive experience. Then there is electrical aversion therapy. This approach involves applying painful electrical shocks as an aversive stimulus. This type of aversion therapy is considered controversial and is rarely used. A simple aversion technique for a smoker is the use of a rubber band. They can pop the rubber band every time the urge to smoke comes about. Many other methods of aversive conditioning are highly effective. Finally, there is operant conditioning. First introduced by B.F. Skinner, operant conditioning is the process in which behavioral change, or simply think of the term learning, occurs as a function of the consequences of behavior. Examples are teaching a dog to do tricks and rewarding behavioral change in a misbehaving child. This term is the equivalent of instrumental conditioning. We also use the term operant learning. Now, let us talk about cognitive therapy. This is a form of psychotherapy based on the concept that emotional and behavioral problems in an individual are, at least in part, the result of maladaptive or faulty ways of thinking and distorted attitudes toward oneself and others. The objective of the therapy is to identify these faulty cognitions and replace them with more adaptive ones, a process known as cognitive restructuring. The therapist is an active guide who attempts to make the client aware of these distorted thinking patterns and helps the client correct and revise their perceptions and attitudes by citing evidence to the contrary or eliciting it from the client, also called Beck therapy. Then there is rational emotive behavior therapy, known as REBT, created by Albert Ellis. This form of cognitive behavior therapy is based on the concept that an individual's self-defeating beliefs influence and cause negative feelings and undesirable behaviors. Specifically, a person's problems result from turning healthy desires for success, approval, and pleasure into demands. For example, I must achieve outstandingly well in one or more important respects, or I am an inadequate person. Because of its emphasis on thinking, feeling, and acting as integrated and holistic processes, REBT uses a variety of cognitive, emotional, and behavioral techniques to directly and emphatically interrupt clients' irrational beliefs and encourage them to think and act in more effective, self-enhancing, i.e., rational ways. Originally called rational therapy, RT, and subsequently rational emotive therapy, RET, it became known by its current name during the 1990s. The ABC model is the three-term possible events of antecedent, behavior, and consequence. An antecedent is something that comes before a behavior and may trigger that behavior. Remember, a behavior is anything an individual does. So a consequence is something that would follow the behavior. Some facts regarding the ABC model. Looking at behavior from an ABC perspective is part of a comprehensive functional assessment, an extensive set of procedures to identify the causes of maladaptive or socially incorrect behavior and reduce it through teaching replacement behaviors instead of suppressing it through punishment of a behavior. Using the ABC model is an effective way to understand why a behavior happens. Several ABC data sheets provide a brief snapshot of what happens when an individual participates in a particular behavior. It lets us see what is going on in the environment before the behavior that might trigger it and what happens after the behavior that might allow it to continue. The ABC model can also be effective for increasing behavior. For example, we can use specific antecedents to trigger behavior we want to increase and follow the behavior with a consequence that will increase or continue that behavior. See the examples below to see how this is done. Collecting data in ABC format does not require extensive skill or time. This data is helpful to the person writing the plan. The data forms for ABC data collection are often simple checklists or other grids that are easy to use. You also have what is called eclectic psychotherapy. This is when any psychotherapy that is based on a combination of theories or approaches or uses concepts and techniques from several different sources, including the integrated professional experiences of the therapist. An example of this would be incorporating psychodynamics with choice theory/reality therapy. With the more formalized prescriptive eclectic psychotherapy, the clinician attempts to customize psychological treatments and the therapeutic relationship to the specific needs of individual clients. This is done by drawing on effective methods from across theoretical camps and by matching those methods to particular cases based on empirically supported guidelines. Group therapy treats psychological problems in which two or more people interact with each other on an emotional and cognitive level in the presence of one or more psychotherapists who serve as catalysts, facilitators, or interpreters. The approaches vary, but in general, they aim to provide an environment in which problems and concerns can be shared in an atmosphere of mutual respect and understanding. Group therapy seeks to enhance self-respect, deepen self-understanding, and improve interpersonal relationships. Another modality is couple therapy, in which both partners in a committed relationship are treated simultaneously by the same therapist or therapists. Couples therapy concerns problems within and between the individuals that affect the relationship. For example, one partner may have undiagnosed depression that is affecting the relationship, or both partners may have trouble communicating effectively with one another. Individual sessions may be provided separately to each partner, particularly at the beginning of therapy. However, most of the therapy course is provided to both partners together. Couples therapy for married couples is known as marital therapy. Lastly, there is family therapy, which is a form of psychotherapy that focuses on improving interfamilial relationships and behavioral patterns of the family unit as a whole and among individual members and groupings or subsystems within the family. Family therapy includes many treatment forms with diverse conceptual principles, processes, and structures, and clinical foci. Some family therapy approaches, like object relations theory, reflect extensions of models of psychotherapy with individuals in the interpersonal realm, whereas others, e.g., structural family therapy, evolved in less traditional contexts. Most of these approaches emphasize contexts in which clinical problems arise. This accompanying systemic view potentially allows clinical attention to all levels of the organization of behavior, from the individual to the family and to the community. Family therapy models vary enormously in terms of length, past versus present orientation, techniques used, and treatment goals. Some key points to know. First, group therapy may not be for everyone. Some clients prefer the individual attention of a therapist, and some may be reluctant to share their problems with others in a group. There may be some clients who will feel too inhibited to relate to others in a group. Family therapy helps troubled families learn to communicate better and resolve their differences. Couple therapy helps distressed couples resolve their conflicts and develop more effective communication skills. Well, this will be the end of this video lecture. Please continue to read the entire chapter. Part 2 will be provided later. Before wrapping up, I just want to point out how culture is an influential component of psychotherapy. As therapists, we are trained to be sensitive to cultural differences among the different groups of people we serve. Being a culturally sensitive therapist involves respecting and understanding the customs, cultures, and values of the people we treat. Therapists also need to adapt their treatment approaches to clients from diverse backgrounds. Self-awareness is an important factor to the process. Therapists must be aware of their own cultural biases to avoid stereotyping clients from other cultural groups. Regarding the profession, this is a requirement, not a suggestion. It is embedded in our code of ethics and is seen as a skill-based competency.